Hey, Mr. Hunt. My name is Sheena West, one of the nurses recruiters here at the local hospital. For today, I'm going to ask you several questions, okay? All right. So, for the first question, tell me about a time in clinicals at FTCC in which you delivered high quality, patient centered care to individuals, families, groups, and communities in varied settings.
Thank you, Ms. West. Every clinical shift, I use the nursing process to provide a high quality, patient centered care to any client, including individuals, families, groups, and communities in a variety of settings. The nursing process, also known as the API by some, assists me when caring for patients and is an evidence based practice that improves the patient's overall health. During my previous clinical shift, I had a diabetic patient who was admitted due to hypoglycemia with a BJO of 420. I began the API process after carefully reviewing the established protocol policies at Cape Fear Valley. First, I assessed my patient by observing objective and subjective data, taking a medical history, performing a physical examination, and asking pertinent questions. During my assessment, the patient informed me that he does not check his blood sugar because he lost his glucagon last month and has not received a replacement. The next course of action was to recognize that lack of diabetes education as evidenced by high blood sugar levels and a lack of knowledge. Third, I set priorities based on the needs of the clients and protocols, as well as plan adequate time for interventions. During the intervention phase, I administered insulin and normal saline as prescribed. Teach the client about hypoglycemia manifestation and encourage oral fluid intake to prevent dehydration. Finally, I evaluated the patient's progress toward outcomes and the efficacy of the nursing care plan. As a result, the patient's blood sugar level returned to normal and the patient became more alert and active. The patient thanked me for educating him and the care I provided. The patient stated that he would never put off checking his blood sugar and that he would do so daily to avoid hyperglycemia.
Thank you, Mr. Hunt. My next question. Why does this example meet this objective?
Thank you, Ms. West. This example meets this requirement because the nursing interventions were both appropriate and effective. All expected outcomes were met within the time frame specified and no additional actions were required. Furthermore, by utilizing ADPI, which is evidence-based practice in all patient care settings, I will always provide high-quality patient care to individuals, families, and communities in a variety of settings.
Thank you, Mr. Hunt. My next question is, tell me how you use something you learned from one of your class assignments to incorporate best practice and professional values and standards into compassionate nursing practice.
Thank you, Ms. West. My first semester of nursing school required us to complete a research project using the PCOT model, which focused heavily on evidence-based practice. The application of evidence-based practice ensures that clinical practice is founded on solid evidence and patients benefit as a result. Evidence-based practice also leads to more consistent clinical recommendation and practice across the healthcare system. In my daily nursing practice, I always incorporate evidence-based practice for best practice as well as professional values and standards. For example, I always perform hand hygiene before and after leaving a patient room. I perform hand hygiene inside the room so that my patient is aware and so that I can educate my patient about the importance of hand hygiene in preventing infection. By doing so, I will instill trust in my patients. As a result, each of them expressed their gratitude and thanked me for keeping them safe.
Thank you, Mr. Hunt. My next question is, did the outcome of using this new knowledge improve the outcome of the situation you used it for? Why or why not?
Thank you, Ms. West. Yes, evidence-based practice has been shown to improve patient care and outcomes, and it is a necessary component of providing safe, high-quality patient care. According to research, when nurses practice evidence-based practice, such as hand washing, patient outcomes improve.
Thank you, Mr. Hunt. My next question is, tell me an example of how you have demonstrated cultural and global congruency in the healthcare environment with diverse populations in promotion of healthy lifestyle and preventative health screenings in clinicals at FTCC.
Participating in the Cumberland County Department of Public Health's COVID-19 task force was an example of how I demonstrated cultural and concurrency in the healthcare environment with diverse population. Its goal is to provide the same level of care to everyone, regardless of religion, ethnicity, language, gender, or other factors. I was assigned a booth with one of my nursing classmates, and we began the task as soon as the vehicle arrived at our station and the process began. First, we get the clipboard containing the paperwork they were given before entering the bay. Second, we double checked their appointment online to ensure they were eligible for the vaccine. Third, we read the statement that informed the patient about the vaccine and then obtained verbal consent from the patient, as well as provide them with a CDC vaccine pamphlet. The vaccine was then administered IM in the dental muscles. Dental muscles. Finally, we informed the patient that they should follow traffic controllers to the parking lot and wait for 15 minutes to observe any signs or symptoms they may have. Also, we informed them that if there's an emergency during the event, they should sound the horn or flash their lights, and EMS personnel will be on standby. This made patients feel important because we cared about their health and culture, resulting in a more pleasant and comfortable environment for the patients. This community was thankful for the vaccine and appreciated the staff's efforts during such a trying time.
Thank you, Mr. Hunt. My next question is, how does incorporating this impact how and what you present inpatient discharge information and education?
Working with a diverse population was a difficult task during this discharge information and education provided by this task force. I make certain that I use clear, consistent language that the client would understand, and I use the teach-back method to ensure that the patient understood. Furthermore, the task required the presence of a telecommunication interpreter on site to ensure that everyone understands the vaccines and the risks it may pose, as well as the signs and symptoms that may arise. The pamphlet also included phone numbers and vaccine-related resources.
Thank you, Mr. Hunt. My next question is, describe a situation in SIM or clinicals at FTCC where you functioned as an effective member of the healthcare team, demonstrating excellent interprofessional collaboration.
On our final sim day, we had to perform an ACLS skill. Each team member was assigned different roles and tasks during this event, such as primary, charge, medication, monitor, recording, and physician. By repeating back orders to confirm what was said, I demonstrate excellent interprofessional skill with my team members. This ensures that the information received is accurate. Furthermore, I engage in active listening, which entails processing all signals sent, including body language, to facilitate better organization of information so that it can be used properly. As a productive team member, I uphold trust, respect, and collaboration. As a result, these skills have improved my collaboration skills, allowing me to work effectively in a team and ultimately improve patient outcomes.
Thank you, Mr. Hunt. My next question is, what skills have you learned in classes at FTCC have increased your communication skills in SIM and clinicals at FTCC?
While I was attending classes at FTCC, my previous instructors taught me a unique communication tool that uses key information that is accurately transmitted and allows the receiver to ask questions. This communication tool's name is SBAR. This acronym is an abbreviation for situation, background, assessment, and recommendation. Using SBAR improves the effectiveness of my communication with my team members, which is critical for developing teamwork and patient safety, both of which are our top priorities as nurses as we strive for zero harm. It's easy to use and emphasize the key components needed to send and complete messages. For example, when I use the SBAR, I make certain that my facts are organized in accordance with the SBAR checklist. Keep it as short as possible while including all pertinent information.
Thank you, Mr. Hunt. My next question is, describe how you have demonstrated beginning skills in point-of-care leadership, management, and care coordination using effective communication skills through either successful completion of class projects or a clinical situation or experience.
As a nurse intern, I had the opportunity to be the charge nurse for my fellow classmate in clinicals. I was in charge of 4 of my classmates and their patients. For example, I had to ensure that each of my classmates' physical assessments, nursing notes, and daily safety rounds were completed on time. Every hour, I checked in with my classmates to see if they needed anything and to make sure they weren't falling behind on their daily tasks. Prior to lunch, I began reviewing each of my classmates' documentations through Epic and discovered that the majority of the students did not document or care. They either either did not offer the patient oral care or the patient refused and it was not documented in the charting. I was aware that oral hygiene care was one of the top priorities discussed during the morning debrief at the LTAC facility due to an increase in infection, and the situation needed to be addressed. I approached my team members in a professional, calm manner. After inquiring about the task, I notified my classmates that I am available to assist if they have not provided oral care. 2 of the 4 students informed me that they had provided oral care, but excuse me, that they had provided oral care but had forgotten to document it, and the other 2 requested my assistance. All of my classmates thanked me that day, and they were able to catch up throughout the day. As a resource nurse, one of the most important aspects of the job is to use effective communication skills.
Thank you, Mr. Hunt. My next question is, how do you plan to grow and strengthen your leadership skills in your practice as a nurse?
It is critical for nurses to develop effective nurses leadership skills because we are advocates for the profession, patients, and other nurses in order to maintain a positive and professional work environment. As a nurse, I intend to continue to develop and strengthen my leadership skills by being efficient, having clear, effective communication skills that includes active listening and feedback, professionalism, integrity, and critical thinking, to name a few. In addition, I plan to take leadership classes offered by the company and continue my nursing education.
Thank you, Mr. Hunt. My next question is, describe how you implement safe and competent care to individuals through both system effectiveness and individual performance in varied healthcare settings.
I had a patient who was diagnosed with respiratory failure and a variety of other health issues. The patient was in a wheelchair and had a trach. Throughout my clinical shift, the patient attempted to get out of bed and into the wheelchair on several occasions without assistance. As a student nurse, I recognized the safety of this patient is a priority and began to implement safety precautions to prevent further falls. First, I completed a fall risk assessment via Epic. Then I oriented the patient to the surroundings and ensured that the client knew how to use the call light and inform him to press the button when he needs assistance or would like to transfer into a wheelchair. As a student nurse, I ensure I responded to the call light in a timely and efficient manner. In addition, I perform my daily checks every 2 hours, which include pain, reposition, potty breaks, and checking for safety such as floor clean and free from clutter. I kept the bed at its lowest setting and locked the brakes. Electronic safety monitor devices such as bed sensors were put in place. The patient was then educated on safety risks and the plan of care. As a result, the patient suffered no injuries from falls or attempts to get out of bed, and he used the safety precautions such as the call light that were placed when assistance were required. At the end of the day, the patient expressed gratitude to me for keeping him safe and caring for him.
Thank you, Mr. Hunt. So, for my last question, tell me about a specific clinical situation in which you identified something unsafe for a patient and what you did about it then and why. Would you change what you did then now? If so, why? And what would you do differently?
During one of my Med-Surg hospital clinical shifts at Cape Fear Valley Health, my preceptor informed me that we would be receiving a new patient admitted for seizure in less than an hour. When the patient arrived on the unit, I went into the room to introduce myself as a nurse and to conduct an assessment. There was no suction, bed padding on the rails, oxygen mask, or BVM near the bedside. I informed my preceptor and she assisted me in gathering supplies. I explained to the client that the precaution we are taking to ensure his or her safety. Furthermore, I informed the patient to press the call light if assistance is required and to ensure that the patient is left in a safe position. If I could go back in time and change something about the patient's care, I would make sure that all equipment and safety precautions were in place prior to the patient arriving at the unit, as well as that we follow the hospital's seizure protocol.